Good afternoon, everybody. William Albanese here from Aspira Health, CEO, pharmacist, managing director, along with my good friend Christopher David, VP of marketing, all around
partner.
Managing partner. Yeah, he manages stuff.
Sounds good.
We are here this afternoon in a brightly lit room. We just opened the windows up. The sun is blasting in. Kind of nice to have the natural sunlight.
Yeah. I mean, it's just getting dark so early. It's kind of depressing.
It is a little depressing. Yeah, it's kind of that time of year where you're just like, blah, you're like, why am I so tired? And I always blame it on the clock change, but really the lack of sunlight's killer because I'm used to spending 12 hours on a beach where it's sunny all day and I just feel great. You're walking around, you're fantastic, and then winter hits and bam, you're like, oh, I feel horrible. You know what I mean?
Just 2 months ago, we were all sitting on beaches, soaking up that vitamin D, the vitamin E. Yeah,
bronze bodies.
Looking strong.
The beach is that way.
And now we got to slam a bunch of Red Bulls to try to get the jazz back. So,
what flavor are you going with tonight?
All right, I got blueberry. How you doing?
I'm doing watermelon for my energy boost.
I love watermelon. It's the best melon.
Speaking of summers, yeah. That reminds me of the comment where it was like, hazelnut, that's the best kind of nut.
Hazelnut's a legume. No, it's not.
Is it?
No, I made that up.
Interesting facts. It's quasi-facts.
Let's reel it in here.
But hashtag not a sponsor. We got our Red Bulls here, just talking. We were talking about the light, and Chris was telling me that he had a hard time with the transition of the seasons because you always kind of feel down in the fall. And I said, hey man, you are normal and right in line with millions of other Americans that suffer from seasonal affective disorder, where you're just down during the season and it's not any fault of your own. The one thing people don't realize is that your thyroid really drives all these chemical changes in your body as the seasons change. And I think it's amazing to kind of look at this little itty bitty like pea-sized kind of like hormone or pea-sized organ in your kind of like neurological network that releases hormones that cause these far-reaching effects and can last for a very long time and cause major impacts, right? Yeah. So, it's good. No, so basically, to talk about the thyroid, you really want to look at what it does and why it does it. And the thyroid is there to change things over long periods of time to prepare your body for different stages as it goes through the season. If you have a hyperthyroid gland and you're very active, which is what happens during the summer months, you have more thyroid hormone going into your bloodstream, messaging your cells and telling them to consume more energy. It's telling your brain and body that you feel great. You're out there. It's like, imagine it follows the seasons. You're out there now when the sun's shining. You're going to go make hay. You're going to go hunter-gatherer. You're going back to your primal instincts in a small way. But you're also...
primal there.
Yeah, I mean, like evolutionary biology here kind of deal,
right.
And then when you get into the winter months, you're going hypothyroid in the fact that you're decreasing the amount of energy that your body is going to take because you're kind of resting and you're preserving yourself through the winter months, and you might become a little depressed, you might become a little under the weather, but you're definitely messaged to do these things by the amount of light that you're taking in on a daily basis, which is why light therapy exists, to try to get people to feel better. And that's why, we check thyroid levels as the first line of depression, because when you're tired, you're tired, and you're not tired because you haven't slept enough. You're tired because you're getting messaged from your hormone system that you are not, you need to sleep, you need to rest, you need to conserve energy to get through the winter. Primal kind of deal, so.
But you can oversleep though, right?
Oh, I don't feel like I could. Just give me that chance. But no.
You want that
the right
amount of sleep. You don't want to undersleep or oversleep. And you definitely don't want to drink as much caffeine as we do.
Right.
Probably not. But
yeah, I don't recommend anything.
Yeah, that's probably why I have seasonal affective disorder. I tried the light, by the way. I don't know if it makes a huge difference.
There could be, I don't know. I'd have to look at some of the stuff in it, but there's different wavelengths of light. You've got different,
I have a cheap one, by the way, so.
You got the one incandescent bulb screen.
40 watt.
Got to spring for at least 60. Jeez. No, there's a lot of bandwidth, A good indicator of that is like, so blue light will disrupt your sleep and alert your brain that you're still awake, whereas darker lights like red light or, like incandescent bulbs actually tell you you're not seeing that spectrum on the visible light coming into your brain, so you actually get message that, hey, it's time to slow down and go to sleep.
Hold the phone there, Doc. Are you telling me blue light could keep me up at night before I'm trying to fall asleep because of my hypothalamus?
Well, that is direct messaging where you're taking an image in your ocular nerve. It's going into your brain, messaging your brain and saying, hey, you're still taking in blue light. It must be light outside. Go get out there and make hay, and you're not going to be tired. Right, yeah, so that's like, that's not related to the endocrinology of the hypothalamus, but it is related to sleep and sleep cycles, which is why they say good sleep hygiene. Hey, turn that TV off before bed because there's a ton of blue light coming out of there telling your brain, hey, you're still awake, you should be up doing stuff, and then you're not tired when you go to bed.
Yeah, if I'm like kind of tired, I'm like, oh, I'm going to treat myself with a little Reddit right before bed, just 15 minutes, and then I'm on there, and I'm like, well, I'm wired now, might as well stay up.
Not to mention you're engaged, like it's not really, it's very engaging, I think, when you're on Reddit. You're anxious to read the next thing and things like that. So.
I heard Tom Brady, and anything that Tom Brady does, I take, Bible right there. But no devices half an hour before bed. Quiet, no devices in bed, actually. Keep the devices out of the bedroom so you're not even tempted, which I can't do that. That's too much. I'm not Tom Brady, so.
Well, and then that's in line with other recommendations you make for people having trouble with sleep. So if you come in and you say, hey, I can't get to sleep, the first thing I say is, are you consuming a lot of liquid before bed? Lots of people have a beer or two, that maybe they drink a couple of cups of water. Then you got to get up and go to the bathroom, so you're disrupting your sleep and not getting into those deep cycles of sleep. Well, other things too, we can come back to that. But other things too, we always say drink non-caffeinated beverages, especially before bed. Don't go having a soda for dinner. Turn off blue lights. Don't drink as much fluid, or limit your water intake, and just general consistent sleep schedules. If you're going to bed at 9 one night and 1 a.m. the next night, you're going to have trouble falling asleep the following night at 9 if you go back to that. So you stop me right there, and you want to talk about?
I was going to say that you brought up beer just on the fact that you'd have to go to the bathroom in the middle of the night, but I mean, there's a lot of sleep studies out there that talk about how beer or alcohol in general, even just one drink, will hinder that REM sleep.
Correct. You're very right. Yeah.
And what's the importance of REM sleep? Because I'll tell you, after a couple beers, I feel like I sleep amazing.
So you're getting your results are not matching your emotions, I should say. I don't know how to say it, but it doesn't help.
As good as I feel.
Drugs and alcohol, drugs and alcohol, including caffeine, which is a drug, will inhibit your sleep. So really you want to limit all that stuff. Chugging a beer or two before bed, it knocks you out because you get lethargic. And, remember, alcohol affects your brain. It gets into your brainstem, it gets into your cerebellum. That's why people, have trouble with motion after a while. It's all your neurological stuff. Alcohol saturates everything. So it also saturates those neurons in your brain that are necessary to get you that regenerative REM sleep that you're talking about. You kind of go down overnight. You go to bed and you start out at level 1, 2, and 3, and each time you're going deeper and deeper into sleep. And then that fourth level is that REM, or rapid eye movement sleep. It's also called paradoxical sleep because you look like you're awake, but you're actually very, very in a deep subconscious, you're in a very low level of sleep where you're very, that's where you're dreaming, that's where you're getting all those active things. And some people say like, oh, I stopped drinking, I got my dreams back, or I stopped doing this, or I changed my habits and all of a sudden I'm dreaming again. Well, that's because you're starting to get into that sleep again, and you've just masked it by not getting there with that, you're not getting there because you're not having good sleep habits.
Yeah. Do you dream in REM or in more of a light sleep?
You have to get into REM sleep. I don't know if you noticed this, but a lot of times your dreams will happen in the early hours in the morning. Yeah,
I noticed that a lot.
What your brain does is your brain works to take you down a few levels, and then it comes back up, and then it goes back down, and it goes back up. And you have these wave patterns that you go through when you're sleeping, and each time you go further into sleep until you finally reach the REM sleep, which is why it generally happens early in the morning. Kind of cool, right?
It's very cool.
That's when I wake up screaming, 3 a.m. Ah!
That was my line, Will. You stole it.
What's going on? So that's REM sleep in a nutshell, more or less.
That's awesome. So we kind of talked a little bit about what you can do to help with your your sleep, but how do you know if you've really gotten good sleep? Maybe I'm just so convinced that I can still drink a 6-pack and go to bed and get great sleep.
Long term, you're going to suffer negative effects of that. You're not getting the regenerative sleep where you actually, when you're in that REM stages, you know, science is still figuring out exactly what the brain does in these types of things. But one thing we've kind of figured out is that you're really retaining the information that you gathered during the day. You're putting it in your long-term memory. You're kind of locking it in. So getting to that REM sleep is important. You may not notice it initially, but you may over time begin to feel better. If you're consistently sleeping at the same time each day, you're going to have better, I think, daily routines and daily days, you know.
So it helps with memory function.
Did I say awesome. daily days?
I think you did.
Double.
We might both be in a bit of a daze.
Redundancy, Department of Redundancy. Yeah, so
it'll help with developing memories, and I didn't know that. So it actually kind of helps store those recent memories in more long term. That's awesome. It's going to help with the what was it? The hypothalamus. What was it? The thyroid.
Yeah. So we're kind of talking about seasonal affective disorder. Your thyroid is kind of like what's creating those symptoms, I should say, where you're saying like, hey, I'm tired, I feel depressed or down, or or even gaining weight too. I don't know about you guys. It's not just the holidays. It's your body messaging the cells, say, hey, it's going to get cold soon. You ought to take on more fat stores so that you can sleep through the winter and be healthy until the summer comes.
Yeah, we're still hibernating deep down in our DNA.
Yeah, absolutely. I mean, that stuff doesn't go away just because we created supermarkets, right? So there's a lot of benefit. The thyroid is an interesting organ in the sense that it has these drastic impacts from very, very small doses of hormones that are put into your bloodstream, basically. And they drive these cycles that you and I feel. And sleep is just one of them, where sleep, good sleep and restorative sleep is a little bit different than the seasonal changes that come with the thyroid, but all this stuff can be monitored with, the millions of trackable devices and things out there.
That's what I was going to mention. I had a Whoop strap at one point, and honestly, it was just overkill. I loved it for the actual sleep track because it would tell me how many REM cycles that I went through when I had interrupted sleep. And with a couple young kids waking up in the middle of the night, it was nice to be able to see, like, all right, how was my sleep last night versus the previous nights, and gauge whether or not I need to go to bed early that night. But I started looking into other trackables. There's a Oura Ring as well, and
I saw it. That's really cool. It's a ring, right? Yeah, it's kind of neat. Yeah.
Yeah, there's a whole lot of different options. Fitbit has a wide array. They might be owned by Google. I'm not sure, but I think their battery life's only like 18 hours, so doesn't really. I don't know if you're meant to wear it through the night. But regardless, there's a bunch of other really cool sensors on there as well. I don't know how they would pertain to seasonal affective disorder, but I did see that some of them will track your stress, and then also you'll be able to. You can actually like go in the app and it'll walk you through like some meditation as well if you're too stressed out.
So you have something telling you you're stressed.
Yeah, you're like
that doesn't help. That helps to stress a whole lot. Thanks.
I'm stressed.
Thanks, Siri.
So nothing like a device telling you to calm down, gaslighting you constantly.
I didn't know about that. I was unaware of that. I mean, and then Apple's iWatch came out with the EKG on it, where they're actually looking for AFib. Yeah.
Yeah. Tell me a little bit more about that EKG. Is it as good as a regular EKG?
I don't think any doctor would say it's as good.
Yeah.
However, I do think that there is a good place for that when you come to look at someone. There's been studies that have shown that it is just about as accurate at picking up someone in AFib or atrial fibrillation. It's almost as accurate as a diagnostician, or it actually helps to prompt people to go seek care when they need it.
Got it.
AFib is not by itself going to kill you. What it just means is your atrium, which is 10% of your heart. It's that first chamber that the blood goes into.
It's the powerhouse, right?
It's like it's the power stroke kind of deal where it puts it in the ventricle, and the ventricle is the giant muscle that whoosh, pushes it through. But your atrium, if it's in fibrillation, which is like rapid contractions, it's not pumping efficiently. So if you don't have it firing right, it can lead to long-term disability and definitely death if it's not taken care of over time, because it can lead to other things like ventricular tachycardias or ACE. There's lots of scenarios that can come out of it. And you get ventricular hypertrophy, which is a fancy way of saying.
Complicated.
I know, right. Let's stick to the Red Bulls. But the EKG machine on the Apple iWatch is something, I will tell you this much, consider it for my dad who had a heart attack recently. It'd be great to know if he was in, atrial fibrillation and he should seek out additional care.
So if you think you've got like heart problems, then the iWatch is probably best. But if you just want to track your sleep, the Oura Ring, or the Fitbit, or the Whoop strap. I don't think the Whoop strap will track your temperature, but I thought that was pretty cool. Some of these devices will track your temperature and your resting heart rate. So
you mentioned you liked the Whoop strap too, right?
I did. It had a lot of bells and whistles. Really meant more for like the high performance athletes, not me, who doesn't really go to the gym a whole lot and just like likes to track his sleep for $30 a month.
Sure, doesn't go to the gym.
Yeah, never go to the gym.
Yeah.
But,
I barely go to the gym. You need me to lift this up here?
Don't you shame me in front of our audience here.
I know. I'm just really upset that he goes to the gym. Really, I live vicariously.
Once a month.
Yeah.
I invited him one time. Now he thinks I go after every single meeting.
Oh, you work out more than I do. I'll say that much. I appreciate the invites to go kayaking too.
Dude, yeah,
that's cool.
We should do one of these out on the water one day.
Be pretty awesome. I would love to do that. Yeah, lots of stuff. Paddleboard, kayak, we're near the beach, so we love going out in the ocean, the bay. We have a bay and an ocean, so we get blessed with everything. Yeah. It's awesome. But no, the wearable devices are definitely, they have their purpose. I think where all of them fit in pretty well is they're good at surveying or sampling something quickly, but they're not great at diagnosing a problem. I wouldn't go to a doctor and say I have AFib, look at my Apple iWatch. I would go and say I'm worried I have AFib, and then they can do further diagnostic tests with more advanced instruments to get you better results. Same thing goes, you mentioned, I think it was like blood oxygen level. A lot of them do pulse ox, right? Fancy way of saying how much oxygen is being carried by your red blood cells. And ideally in, most you and I are 98, 99, 100%. When you start dropping below 94 and below, you start worrying and say you're not actively carrying oxygen to your cells. It's that little red light they put on your finger, and the same technology exists in all these wearables. It's a good survey. Even in our medical facility, we have the finger ones we put on, but we don't like those as the best instrument. If I'm going to diagnose you and you're coming to a doctor's office, I'm going to get out the vital cart with the equipment on it and actually get a better pulse ox that attaches directly rather than one that's kind of like a clip-on. Same thing with the wearable devices. Great survey. If I need to go out to your car, make sure you're okay to come in, just double check you, like, oh, I'm having trouble breathing. Go out with one of those and assess it, or a watch would be, that's, hey, my oxygen saturation's at 91%. I don't feel good. I'm going to go get checked out,
What if you think you have like sleep apnea? You're not quite sure, but you're not sleeping great and you're trying to kind of dial it down. Will the O2 sensor, if it's low, will that help tell you if you have sleep apnea or anything like that?
It could potentially help diagnose something like that, where you're like, I'm consistently dropping levels, like spiking in the middle of the night or something to that effect. And, as you know, sleep apnea means you're not breathing. Yeah, so it's something to check out, something that you could wear throughout the night, get a general assessment if you're ever worried about it.
And then I did see, and we can wrap it up in a second, but what I thought was really cool about some of these wearables is they'll actually give you a score for like your overall recovery, which I thought was neat. It'll take in how much you've exerted yourself over the last couple days versus how much you've slept, how stressful you are, and how stressed out you are, and they have an algorithm, which certainly helps with the stress levels, right?
My watch says I'm stressed, I'm definitely stressed.
I gotta relax.
Yeah, no, I think that I think those are interesting tools. Like I said, I think the best way to summarize it all is that they're good surveys. It's gift-giving season with Christmas upon us.
There you go.
Yeah, it's not a bad gift to get. Now, if someone's technologically challenged, maybe pivot away from that. But if they want to, if they're interested, or you have a loved one that you're worried about and you want to set it up for them or anything like that, I think they're great devices. I think there's a fantastic need for them, and I think they're really good. It's about interpreting the data you're getting from them and kind of looking at it more and discussing it with your doctor.
So if you think that you have, or if you know that you have seasonal affective disorder and you're feeling a little bit down, what do you do? What's the first thing that you should do?
Ooh, seasonal affective disorder. Well, you can come to Aspira and you can talk to somebody. Sometimes medications are warranted. The best thing we like to do first is lifestyle modifications. So we talked at the beginning, what are your sleep habits? actually getting up, you said in the beginning, is there such a thing as sleeping too much? And yeah, if it affects, if it affects your day-to-day life, you could have other things too. You could have bipolar disorder where you go from manic to, depressive where you're sleeping too much or, excessive consumption and things like that. So it could be something else that the doctors need to look at and ask questions and survey you for. Okay. You might also need help. Who knows? If you're sleeping a lot, maybe you're depressed and don't know it. So you need to get in and get seen for depression. But the trackables and the things you can do for seasonal affective disorder are the things you would do in everyday life, which is staying healthy through exercise and diet, good sleep habits. Definitely get out there. If you're in a setting where you're just no sunlight, get out there and get yourself some sunlight. Make a commitment to walk at lunch or something, where you get out on a walking track. The facility we're trying to build is going to have a walking path all the way around it.
That's so cool. Where is it? Where's it going to be?
We're going to be right around the road, hopefully Plantations Road, which is about half a mile from here, about a mile from here. Yeah, it'd be really nice, but it'll be, getting out there and doing the things you normally do. And then if those things aren't helping you get past it, I think knowledge and understanding that it's temporary, is good. And then you kind of look at it from that light and you say, do I need additional help or am I just down, because the sun's down, And then if it starts affecting your day-to-day activities where you're just not the same person and you need some help, you can get seen. There's medication you can be put on that can be short-term too. If you need an antidepressant or if you need something that's going to help you or any, motivation. Sometimes it's maybe a circle or something like that where you talk with other people, maybe counseling. Those are all things that would help get you out of that kind of seasonal affective disorder.
That's awesome.
Yeah, not incandescent bulbs. Stay away from the 40 watt.
Better bump it up to 50 at least.
Yeah, at least. Do they make those? I don't think they exist.
Don't look at your phone right before bed. Don't drink alcohol right before bed. Try to go for a walk once a day. I think, also getting some really basic level exercise, whether it's a jog or just going out and walking for half an hour around the neighborhood, walking the dog, that's actually going to help you sleep much better through the night. I just read a Harvard study that said that 85% of all the people that go to see a psychologist that are suffering from bipolar, ADHD, depression, anxiety, they all had poor sleep habits. So
I believe it. That poor sleep can affect all those things for sure. And do yourself another favor. Go out, take a walk, but at the same time, walk with somebody else. Phone a friend, go out and walking with other people. Another way to feel better, building friendships. Just like this one here, right?
There we go.
Cheers.
Speaking of Red Bull, or friendships
rather. Both. Oh, dear friend. No.
All right, let's wrap it up.
Anyway, we digress towards the end as we always do, but thanks for listening to Between Two Patients, and I'm going to go run off and see some more patients, right?
And I'm going to take a nap.
Later, guys.
Take care. Bye.